Hi, I'm Katrina, and this is Boldly Challenging Ableism. I'm your host, Katrina Simons. I'm the Community Program Specialist at the Institute on Community Integration at the University of Minnesota. This program explores various topics that impact people with disabilities in our community. Each episode addresses a different aspect of our society within the context of ableism. Ableism is the prejudice that stems from the belief or belief system that assumes someone is less capable or less worthy because of a real or perceived difference in ability or function. On this program, we hope to answer some questions you may have been afraid to ask, or maybe some you didn't even know you had. Thanks for joining us. I hope you enjoy the conversation. Hi, everybody. Welcome back to Boldly. Thanks for joining us today. Our guest today is Amy Hewitt. She's the director of ICI, the Institute of Community Integration out of the University of Minnesota. Hi, Amy.
Hi, Trina. How are you?
Good. Could you introduce yourself?
Sure, happy to. My name's Amy Hewitt, and as Trina said, I'm the director of the Institute on Community Integration, and we're a research center that focuses on persons with intellectual, developmental, and related disabilities.
What is your connection to disability? And you can go as far back as you want to or not far back at all.
You know, I started in college working in a support center for people with intellectual and developmental disabilities as a direct support professional. I was a work-study student, so it was helping to offset my costs of college, and I just never left the field after that.
What is your role at ICI, and how does it fit into the disability justice movement?
So, you know, my job now at ICI is to make sure that our research staff and our staff are supported and have what they need in order to do their work. But I am a researcher at a basic level. That's what my job is. And so we do a lot of research and demonstration projects at ICI that are really focused on trying to make things better for people with disabilities, and at the root of all of that is disability justice and disability rights and making our communities more inclusive and thoughtful about people with disabilities.
You work a lot on the DSP workforce crisis. Can you tell us first what a DSP is and why we prefer that term over others?
That is really the focus of my research and has kind of been my passion, although I branched out and do research on things other than the direct support workforce. But interestingly, every single study that we've ever done where we're trying to make things better, trying out a new way of supporting people or a better strategy to include people, when that relies on staff to support somebody, the single biggest factor that influences whether it works or not is the stability of the staff. And so I sort of think about the direct support workforce as really what makes it happen, and everything we want to have happen for people with disabilities, what they want to have happen for themselves. They really rely on people to show up, people to know how to support them in the ways that they want to be supported, and to be reliable and consistent. And when that falls apart, their lives aren't as good. It's just that simple. And so when we think about quality of services that we're providing, whether that's related to employment or health or how to cook or any of those areas of life, if there isn't staff to support somebody, then they're not growing, they're not learning, they're not having fun. Those are the kinds of things that really fall apart. The term direct support professional, that derived maybe 30 years ago in some work we were doing to identify the common skills that it took for somebody to support a person with intellectual and developmental disabilities to live in the community and thrive. And that work was called the Community Support Skill Standards. And when we were doing that, we really reckon all those years ago. In fact, turnover rates, Trina, were higher 30 years ago than they are today. And people talk about it being a crisis. I don't agree with that. A crisis is usually short term. Some event happens, something bad changes or whatever, and a crisis evolves and then it goes away.
Right.
But this has never gone away. These high turnover rates and high vacancy rates have been around since the inception of community supports for people with disabilities.
And are you considering the inception back in the 80s when we attempted to start moving people out of institutional settings?
I mean, that's really when community services pretty much started, right? Because either you got nothing at that time or you were institutionalized. And so
until 83, I think
when we started having, and those dates really fluctuate depending on what state you live in. But yes, in the late 70s, 80s, really hit heavily in the 90s when institutions started to close that were primarily supporting people with intellectual and developmental disabilities. When community services started, we were able to fill positions often with new graduates of college, sometimes who were couples because we had house parents in group homes. That model's kind of gone away, but that's how it started. So we had people who had quite a lot of training. Oftentimes they were special education teachers coming out of college who were working in the first group homes and things. As the system exploded, as services grew and grew and grew, the people who are being hired into these positions have less and less pre-service experience or education, although a third of direct support professionals have some college. We don't talk about that. We typically talk about, or the field typically talks about, them being entry-level employees with no education. That's not really true. A third of them have college degrees or at least some college. So while the numbers haven't budged wildly, the types of people who are coming into the field and their experiences are quite different. And we need more and more and more of them as older people are getting older and requiring services. So there's a lot more competition for people to enter these jobs. That and demographic changes in our country. So old people getting older and needing services, but there also are fewer young people. And so you've got this situation where more and more people need support and services, but fewer people are there to
fill the need.
Take the positions, yeah.
So you said you wouldn't call this a crisis.
I did say that.
What term would you use instead?
You know, I see this really as a systems failure, as us just not planning for what we knew was coming. 30 years ago, we were writing about what was going to happen in 2020. And what we knew was going to happen in 2020 was that tip where the majority of the baby boomers were going to be old enough that they needed support. And so we were cautioning people about 2020, having no ability to understand that 2020 would also bring a major global pandemic, which just catapulted what was already coming into a much, much worse situation. And the reality that so many direct support professionals and other direct care workers left positions during the pandemic, died during the pandemic. So that just worsened primarily the vacancy rates. So the demand for new entrants into the workforce continues to be a big challenge.
Okay. And you and I both work in developmental disabilities. So we work primarily on behalf of people that were either born with their disability or had their age of onset earlier in life, like before age 22 is the federal definition. But when you refer to the crisis, you're not just referring to people with developmental disabilities. You're referring to anyone that needs help and doesn't live in an institution.
Correct. Anybody who needs community support. So it's not just people with disabilities, it's also people who are older and aging. And I'll use my personal life as an example. I know how bad the workforce is, and I know how hard it is to find people, and how if you get somebody, you have to really be on top of it and make sure they've got the skills that they need, make sure they're going to show up when they're supposed to. And so my family's just chosen not to go there yet, because we think while we need help and we need support, it's probably easier for us to figure out how to do it ourselves than to be responsible for making sure people show up when they're supposed to and do what they're supposed to do. And so I think a lot of people are in that situation.
In your family, for example, if you don't mind sharing, and if you want us to cut it out, we can. What sacrifices have you made so that you can provide that support instead of hiring outside?
Yeah, I mean, you just give up parts of your life that you really are looking forward to. We're not really empty nesters, because my husband's brother, who lives with autism and other disabilities, lives in our home too. So we provide his support and then also support to my husband's mother. You know, we love to go to our cabin. We can't go to the cabin whenever we want to because we have to trade off who's going to be there to help support Ginny and Nathan. And so it's those kinds of things. Or we can't go on vacation necessarily when we want, or we're on vacation, we get called back, or just those kinds of things. I mean, it's day to day.
And do you worry about what will happen if either you or your partner gets sick?
Yeah, I don't worry about that so much yet. I do. I mean, I think we'll outlive Brad's mom.
Okay.
I hope she actually turns 88 today, so I hope we outlive
happy
her.
birthday.
I do worry about Nathan. You know, he's quite a bit younger than us, and so we have to figure that out as a family. We're hoping our children might be willing to help, or we can figure out some shared living arrangement when we're not able to do it anymore. But yeah, I think it's if you support a family member who has a disability or who is aging, you worry about those things.
I have a friend who doesn't live in this state. She lives in a different state. But her support needs are very high. She has a high level of support need. And she can't do any. It has always been that way, and it will always be that way. And her parents are getting older now, and so they're really worried about what will happen when they literally can no longer do it at all, because she's already trying to get all of the services in the community, and just like you said, she can't. And through no fault of her own, she's unable to procure and hire the staff that she needs. And
I know so many people like that and you just see the detrimental effect, especially if you don't have family. Like, you can't presume everybody's got family that's there to help and back up when support is needed and isn't there. So many people are faced with this, and there's a lot we can do. There just doesn't appear to be the political will to make that happen always, because it costs money.
Can you talk a little bit about what happens when those support needs are just not met by anyone?
Yeah, well, we know what happens. People die.
Yeah.
You know, it used to be nobody would talk openly about that, because that means that the system's not working. And so then are they going to take the services away? And people talk pretty openly about the situations they find people living in who haven't had support that they're supposed to have. The biggest things that happen to people when there's not enough staff. For example, if you live in a supported living program or in a small group home, you can't get out and do the things that you want to do, because if there's not enough staff to help and support you to do that, and there's not community members stepping up to help, then you're sort of stuck. You're sort of stuck at home or stuck doing what everybody else is doing. And so that's just fundamentally an everyday thing. But we also know that very large percentages, I think it's now around 30%, at one point it was in the 40s, of service providers are turning away people who need services. So they've been authorized to get services, the money's there to pay for those services, but providers just can't support more people because they don't have enough staff. Mm-hmm. And that fundamentally comes down to our departments of labor, our departments of education. Labor and education are the two tickets to workforce development. And I don't fully understand it, but we so often just put this issue, it's solidly a labor issue, and it's an education and training issue, but we place it on human services in states because they're the ones that are offering or paying for and have the oversight of services.
Because it's their problem and it's nobody else's problem, but it shouldn't be.
It's really everybody's problem. It's truly the entire community's problem. We all are going to be faced with needing help from people at some point in our lives, and that's exacerbated if you don't have family. And so, if a new business needs to come into a community, or if, you take any new thing that's been invented and, you need labor to make that happen, our departments of labor in states are supposed to be there to help fill that gap, to help figure out how are we going to incent people to go into certain careers. And our departments of labor just haven't embraced this as their responsibility.
Do you think it's because the job title of DSP is not in that manual whose name is mistaking me?
I don't think it's that easy. I think you're talking about the Standard Occupational Code.
Yeah.
Within the U.S. Department of Labor. And so there are lots of different titles that are used for people who do this kind of work. Personal care assistant is one that's commonly known. Home health assistant or aide is another one that's commonly known. Certified nursing assistant. Direct support professionals, that there isn't a Department of Labor code for that, but they do everything that all those other groups do. They do more things than those groups do too, mainly because of the nature of the kinds of support that they provide and the supports that are needed by people with intellectual and developmental disabilities that can be different than people who have acquired disabilities or who are aging. There's a lot of similarities and a lot of overlap. But for example, direct support professionals from the very beginning of community services have dispensed medications, given medical treatments, implemented OT, physical therapy, speech therapy, behavioral support plans that not all people in direct care roles do or are allowed to do, but direct support professionals do those things.
I don't think the lack of support from the Labor Department of Labor is from not having a code in the...
I don't think that either. I think a lot of it kind of goes back to disability justice. I mean, you can take most issues in services and supports to people with disabilities and get to ableism at some point, and lack of understanding of what people need, lack of commitment to meeting those needs, lack of embracing inclusion. And so I think there's bias on the part of a lot of people. But another part of it is these positions and these jobs are hard. They're highly skilled positions, but we don't talk about it. Even the industry, the field does not talk about them that way. But they are. It's not easy work. It's not an easy profession. And the wages are very low. And so our departments of labor don't really want to invest a lot of time and energy in creating career pathways and incentives to enter jobs that people can't live on. Right. They would much rather invest in manufacturing or other new innovative entrepreneurial type business enterprises where people are going to earn higher wages.
Yep.
And our education programs really respond to what's required. So if as a field we don't embrace that people who go into these positions supporting other human beings need training, specialized training, then our departments of education aren't going to have programs. It's that simple.
What should people do to support the people they know in their community to get the support that they need?
I think the biggest thing is to let people know that they need the support, to make sure that they understand the services, the formal services that are available, but not to limit themselves to those. Humans, I think, at the very core are willing to help other humans out if they know what they want, if they know what they need, and if it's not all on them. So I think making your needs known and combining family, friends, people in your social network, and formal services and supports is probably what everybody needs to be doing. And I think our system needs to change to be able to embrace that sort of holistic support. So I've always said, if you're in an out-of-home service, so you're living in a group home or supported living, and other people are living there with you, which very few people can afford to live on their own if you live on Social Security income. So typically you're living with somebody else. Well, then we just sort of cut family out. Like family can't come in and provide support because of, quote, privacy issues. We have to really think about that and figure out ways that we can combine formal system support with informal family and natural support in order for everybody to get services and to get their needs met.
So do you see a light at the end of the tunnel?
It depends on the day, Trina. I do think we have to think differently, and we have to be working with families when the family's young and when kids are young to be planning for the future and not making assumptions that the system's going to be there, because the system will not fully ever be there. And that's the realist in me talking. I've never seen it yet, and I don't think that that's very realistic. So I think we've got a lot of work to do in educating young families and getting them thinking and planning about how do they build a future for their family that ensures that needs are met.
So you mentioned a lot of barriers, but what would some of the solutions look like?
You know, there's not a single answer. There's not a single solution to this problem. And when COVID-19 hit and we were really in the deep throes of a horrific situation, everybody wanted the one solution. The one thing I hear over and over again is just increase the wages. And that's critical. And wages have gone up quite a bit since the pandemic hit. But what we see is that that's not changing the turnover rates. It is getting people in the door, and the vacancy rates have gone down. But if you don't treat your employees well, and if you don't ensure that they're engaged, and if you don't ensure that they're trained to do their jobs, you can't make assumptions that they know and have the skills to do their jobs, then they leave. And turnover rates aren't budging that much. But when you work with employers, whether that's somebody who directs their own services, so a lot of people, particularly people who receive personal care assistance services and have physical disabilities, whether you're that kind of an employer or whether you're an employer that has lots and lots and lots of direct support staff, you have to learn to be a good employer and to engage your staff and support your staff and give them challenges, but give them rewards. And the whole organizational culture piece, I've said this for years, and I have data now to support. It's just as important, if not more important, than the wage. And this is never going to be a profession that is high paid. It's always going to be at best, livable wages. And so if you're not going to be a high paying profession that's going to attract people because of that, you have to attract people to your employment for other reasons.
So one of the things that really bothers me about that is that it's easier for people with a lower level of need to attract people to the jobs because they have more, like they have dead time to offer during the shift, or they might have, cleaner shifts, or they might have easier shifts, or they might just simply, and I hate to say it this way, but they might just simply have shifts that are more fun. So I almost feel like that's a form of ableism in and of itself, that the people with the lower needs have an easier time attracting staff, and it shouldn't be that way. It should be the people with the higher needs.
Right. So to me, that means we have to have expectations of the different skill sets, because it's a different skill set to support somebody with very high needs, whether those are health and medical, physical, or behavioral. It's harder, and it requires more skills, and as such, you should be paid more, and you should have to have more training in order to have those positions. And so, I advocate for credentialing and certification, and there are a lot of models out there that address that, where if you are supporting somebody with higher needs, your wage is higher.
So our union, we've had a union in Minnesota for I think 15 years now, and our union just started recently, like within the last 5 or 7 years, a sort of something called enhanced rate. Are we able to measure whether that improves retention, and when would we see it? Because I don't think we'd see it yet.
So you should be able to measure that, because what people's rates are, like what their service rates are, how much. So you know who the group of people are that have the enhanced rates. Yeah. So you should be able to tie that back. I think it's important to note, though, that yes, there is a union in Minnesota for state plan personal care assistance services, but that union doesn't represent all direct support staff, and focuses more on the staff that work with people with physical disabilities and who are aging. Yeah. So it's a good model, but unfortunately,
but it has limitations.
Well, and those evaluations aren't, and Minnesota does nothing to really gather the whole picture of all of the staff that support people with different kinds of disabilities in the union, not in the union, the different services that people receive. That could be in their home, that could be in employment support, that could be a mental health support, companion. I mean, there's all different kinds of services that people in these professions provide. And right now in Minnesota, we're not capturing the data that's needed to really understand the complete picture.
And are we not capturing it because it's too expensive?
No, I think it's complicated. And, all the different populations that you've mentioned and that we've talked about, it's not like those services are provided under the same exact
model,
entity or agency in the state. And so you have to go across lots of different programs, and that's harder.
Okay. The DSPs that are in the union, which, as you mentioned, are not very many people and does not cover all types of care that needs to be provided. They received the biggest wage since the implementation of the program. Do you expect for that wage increase to lower turnover rates?
No.
Okay.
not much. Okay. I've just not seen it happen. Okay. It will get people in the door, but if the people are not treated well, if they're not treated well by the people with disabilities that are hiring them, or if they're not treated well by their employer, that happens to be an organization, they'll leave because they can go think about it. There's high demand, there's high vacancy. They can hop around from position to position. It's a both and. You have to have wages that has to be coupled with career support, professional development, engagement, opportunities within your organization, and a positive employer culture. Yeah, it's critical.
Well, we'll ask you next year because it just happened, so we can't say anything yet. But we'll ask you again next year what it looked like.
Yep.
All right.
We might be able to know in Minnesota, but we might not be able to know.
Okay. Well, we'll ask you in season 2.
Sounds good.
Thank you so much for joining us today, Amy.
You are welcome. Thanks for inviting me.
And thank you, viewers, for joining us again, and we'll see you next time.
Boldly Challenging Ableism is a co-production of AM 950, the progressive voice of Minnesota, and the Institute on Community Integration at the University of Minnesota. For more information, please visit ici.umn.edu.